The purpose of this program is to provide you with a better understanding of the medical diagnosis that was given to you or someone you know. This program does not provide specific medical advice. The information it contains should not be interpreted as a recommendation for a specific treatment plan or course of action, and cannot replace the advice of your own physician. What is right for any one person is an individual decision. You should consult with your doctor, who can discuss your needs, symptoms, and treatment.
Our medical director, Dr. C. Everett Koop.
We can plan for and anticipate many things in life, but a health concern is usually not one of them. What I have learned over the years as a physician, as the Surgeon General of the United States, and as a patient, is that understanding a health problem can make a real difference. Over the next 30 minutes, we will take you through the very issues you are probably wondering about right now. By the end of our program, you will have the knowledge you need to better understand what you or a loved one is faced with and what can be done about it. No matter what challenges lie ahead, it helps to be knowledgeable and to stay informed. So stay with us, because we're going to help you do just that.
Hello, I'm Boyd Matson. For a lot of us, it's hard to grasp what depression means. We often hear people say, "I'm depressed," when they feel blue for a day or two. But clinical depression is very different from everyday ups and downs. It's a medical disorder with a clear set of symptoms that affects both your mind and your body. Our program is made up of 4 different reports about depression. In Report 1, we look at how the diagnosis was made and what's going on inside the body. In Report 2, we discuss what happens next. You'll learn about kinds of health professionals you may encounter and how your day-to-day life may change. Report 3 explores options for treatment and management. And finally, in Report 4, we address issues that frequently arise. We'll be giving you a lot of information. To review it, use the booklet that comes with the video. You'll also find a place to write down questions and take notes when you're with your doctor, and a list of other resources that are available. Now, our first report.
Report 1. Understanding the diagnosis.
When I was depressed all the time, it was just kind of why bother? What is the point of me getting out of bed today? Because I didn't see my purpose as doing anything positive in the world. It was more like surviving, existing, getting through that day.
Over the course of a lifetime, as many as 1 in 8 people will become clinically depressed. While it's often called the common cold of mental illness, depression is a condition that requires medical care.
Patients will come into my office and they'll say, if only I were strong enough or good enough, I'd be able to overcome my symptoms. And I tell the patients that that feeling that they have of hopelessness or powerlessness is part of the illness itself. The real issue is that thankfully you've come into my office, we've identified the problem, and now we can successfully treat it so you can go on and resume your previous good life.
There is no blood test or X-ray available to diagnose depression. Instead, your doctor looks for a pattern of symptoms. To learn more about them, your doctor may give you a written psychological test and ask a lot of questions.
One of the things that's very important in the evaluation of depression is taking a life history. So when you go see a psychiatrist, they'll frequently ask you not just about are you eating, are you sleeping, and do you have a lot of energy, but they'll also ask you things in general about your life.
Of all the symptoms doctors look for, the main ones are a loss of interest in things you once enjoyed, and feeling sad or blue nearly every day,
If these changes last 2 weeks or more, they're an indication you have depression, not just a temporary case of the blues.
From the start, bodily abnormalities need to be ruled out by a physician as the potential cause for what appears to be a depression. Things like thyroid disorders, things like medication side effects need to be examined to make sure that they're not the thing that's causing low mood and all of these other symptoms.
But no exam can identify exactly what causes depression. For most people, depression is the result of a combination of factors. These may include inherited susceptibility. Having a relative with depression appears to increase the risk. A lack of supportive relationships, certain personality traits such as low self-esteem, and stressful events like the loss of a spouse or a job.
One of the things we frequently see in the northern climates is a problem we call seasonal affective disorder, or winter blues, in which the decreased sunlight has an effect on the brain in causing affective symptoms or emotional symptoms like depression.
There are also some changes in the body associated with depression. Inside the brain, thoughts, feelings, language, and movement are conveyed through a massive network of nerve cells called neurons. There are billions of neurons that communicate with each other through a system of electrical signals and chemicals. Messages are carried down individual nerve cells by electrical impulses. At the end of each cell, when the message must travel from one nerve cell to the next, chemical messengers, called neurotransmitters, are necessary to carry the message across a gap between cells. These neurotransmitters are contained in pouches at the end of each nerve cell. When the electrical signal reaches the end of the nerve cell, it causes the pouches to release their neurotransmitters into the gap between cells. The neurotransmitters then dock at specific sites on the neighboring cell. When enough neurotransmitters have docked at their sites, the electrical signal is ignited in the next nerve cell to continue its journey. At this point, the neurotransmitters have completed their job and returned to the cell they came from. This is called reuptake because they are retaken up into the cell that released them. In depression, several things can go wrong with this communication system. In particular, there may be reduced amounts of certain neurotransmitters released into the gap between cells, or the neurotransmitters may begin to cross the gap but fail to dock at their sites. As a result, they may return to the cell that released them without delivering their message.
These message delivery problems help explain the effects of depression on your emotions, your thinking, and the way your body functions. And those changes in brain chemistry are getting easier for scientists to see. Using advanced medical imaging technology like this PET scanner, researchers can look at color images showing different parts of the brain at work.
For the first time, a psychiatrist has PET scanning to look at his target area in the frontal lobe, the area of personality, of organization, of behavior, the area that seems to be hit in depression.
The PET scanner is not being used by doctors to diagnose depression, at least not yet. But this technology is helping researchers learn more about depression. The image on the right shows the brain of a person who is not depressed.
We see the high activity, the red and yellow colors, in the frontal lobe of the brain, the area involved in planning and organizing behavior and in emotion. In the patient with depression, this is an area that seems to be decreased in function. Areas of lesser activity are green and blue, and this may be associated with the diminished appetite for activity and the sorry mood that is associated with depression.
What researchers don't know yet is which happens first, the despondent feelings that go with depression or those changes we saw in the brain. But what researchers do know is that depression is a real illness that is influenced by a mix of biology, psychology, and environment. It's not a failure of will or a weakness, and it can happen to almost anyone.
Report 2. What happens next?
The severity of your condition and your overall health will determine what happens next after the diagnosis. The truth is, some things in your day-to-day life may change. You will need to take personal responsibility for scheduling doctor's appointments or remembering treatment plans, and you will want to know what may lie ahead for you.
It's a real pride-swallowing moment when you have to make that first phone call. You're explaining innermost feelings to someone on the phone, telling them that you think you're going crazy and that your relationships and everything are just falling apart. Now, looking back, if I had had the education and known that there's treatments available, and I think I would have been on the road to recovery a lot sooner.
A number of health professionals may be involved in your care. You may receive treatment from your internist or family physician, who may also refer you to a mental health professional. These include psychiatrists, psychologists, and social workers. Psychiatrists are medical doctors or doctors of osteopathic medicine with specialized training in diagnosing and treating mental health disorders. Psychologists have a PhD degree, and social workers a master's degree. If you work with more than one health professional, be sure that each one knows what treatments you're getting and how you're doing. You might wonder what to say to friends or at work. As with any medical condition, it's your choice whether to keep information about your depression private. The Americans with Disabilities Act exists to protect people from job discrimination due to all kinds of disabilities, including depression.
On the other hand, it would be naive to say that people aren't discriminated against. I don't think there's any way in a civilized society that you can justify that, but that's the way it is. I think individuals have to be aware, though, it doesn't do them any good to avoid getting treatment because of concerns about being discriminated against if the illness ultimately kills them or ties up an enormous amount of their productive years.
Whatever you decide to tell friends or people at work, experts do recommend telling those people close to you about your illness.
The more family members know about depression itself and about the patient's particular depression, the more help they can be in the recovery process. So we believe very much in keeping family members informed and involved, at least indirectly, in the treatment.
Sometimes feelings of shame or embarrassment can be a barrier to treating depression. Dave Roos put off getting help for his disabling depression.
You feel like there's a character flaw, that there's something wrong. That you should be able to, if I was a better person, I would be able to come out of this. I would be able to pull myself out of this.
But delaying treatment can be dangerous. Like Dave, some severely depressed people begin thinking about taking their own life.
You feel like your whole world's crumbling around you. You look for a way out.
People who feel that they might harm themselves, have thoughts of suicide, should present these immediately to a health professional, and it's one indication that you might need to be in a hospital.
A short hospital stay can also provide relief from overwhelming responsibilities. A few months after her infant daughter died, Pam Busey found herself sinking into a depression and increasingly unable to care for her 3 active sons.
I put myself in the hospital, and I stayed 2 weeks, and it was a very good thing for me. I was able to get better and well enough to be home again. Some people stay longer, some people stay shorter, but everybody's different with depression.
Most people with depression don't need a hospital stay. They can manage depression with medicine and visits to their doctor. As we've seen in this report, it's important not to let embarrassment or shame keep you from getting treatment. Some people have a single bout with depression and never experience it again. For others, depression is an illness like diabetes that must be managed for the rest of their lives.
Report 3. Treatment and Management.
Your doctor will advise you on what treatment or management approach is recommended for you. It is important that once you have decided on a strategy with your doctor, that you do your best to stick to it. Make sure to take notes on how your treatment seems to be working for you, and let your doctor know how you feel about your progress.
I'd always known that there had to be more. There had to be something more to living than just the pain I kept feeling over and over again. But I never could get past it.
Typically, depression is treated with prescription antidepressant medication, psychotherapy, or a combination of the two. Psychotherapy can be performed by a variety of mental health professionals. Psychotherapy is talking about and understanding problems and finding better ways to cope with them. Your treatment will depend largely on your symptoms and how severe they are. First, let's look at the medications that are used to treat depression. Antidepressants help to regulate the flow of messages in the brain.
Earlier, we mentioned neurotransmitters, the brain's chemical messengers. Many antidepressants increase the level of certain neurotransmitters in the brain by delaying the return of neurotransmitters to the cells that sent them. In other words, they block reuptake. When those neurotransmitters linger around longer, they have more chances to dock at their sites and get their messages through. Since childhood, Merlin Peterson has struggled with reoccurring blue moods. A breakup with her boyfriend left her severely depressed.
There was no light, no color, no anything, just the misery.
When her psychiatrist suggested medication, Merlin was skeptical.
That was very much my thought, that medication was just to, perk you up and keep you happy and not make you think about your problems or take care of your real problems.
So I explained to her, first of all, what these medications were, why they were being used, and what the side effects really were that were associated with them, so that it became much less frightening to her.
It's important to realize that antidepressants, first of all, do not make people high. So that when you take an antidepressant, most of the time, the first couple of times you take it, you're not going to feel anything at all, certainly not in terms of your mood. You might feel some side effects, but you won't feel, oh gee, this makes me feel better or this calms me down. It doesn't have an immediate effect.
So I said, fine, give it to me, let me see how it makes me feel.
The medications haven't changed her personality. What they've done is allowed her to be the type of person that she really always could have been.
The difference now is I don't cry all the time. I only get upset when things need to be upset about.
About 2 out of 3 people will be helped by any given drug. Unfortunately, your doctor can't tell ahead of time which ones will work for you, so some trial and error may be needed.
The first symptoms to actually respond to treatment are the more physiologic symptoms, the difficulties with sleep, with appetite, with activity. It is only later in treatment, and this can be 2 to 3 weeks into a course of treatment, that the mood disturbance begins to improve.
You can't get addicted to antidepressants, but they may have side effects which vary from one drug to another. These may include dry mouth, dizziness, constipation or diarrhea, drowsiness or jitters, weight loss or gain, or problems with sexual function, such as trouble reaching orgasm. If you do experience these or other side effects, you should talk to your doctor about ways to adjust the dose. If you still have problems, your doctor may prescribe a different drug.
It's important when deciding how long to keep a patient on medication to figure out how long the patient has been depressed. The longer the patient has been depressed, the longer that patient needs to stay on the medication. For most people, it's 6 months to a year. When they're off the medication, but they see recurrences of depression, that's the time to see their doctor and get started back on the medication again.
Another approach to treating depression is psychotherapy. Psychotherapy involves talking with a therapist about problems that may have contributed to or resulted from your depression. Research suggests that psychotherapy works by affecting your brain chemistry in some of the same ways medications do.
For the first time in history, we can see that psychotherapy, talk therapy itself, is a biologically active therapy. We can see on SPECT scanners, MRIs, that blood flow is increasing in certain areas of the brain when we talk a certain way about certain things, when we express feelings, when we tell people how we think, and when we talk about our behavior and our relationships. So we know that changes are going on biochemically, neurologically, while we're talking, while we're feeling.
Medications work faster than psychotherapy, but we do have very well-defined, specific psychotherapies for the treatment of depression that clearly work as well as medication in the case of the mild to moderate depressions.
Several kinds of psychotherapy are effective in treating depression. Which type is used depends on one's circumstances. Some of the approaches you may hear about include cognitive, behavioral, and interpersonal therapy.
Cognitive therapy tends to center on identifying negative thinking patterns. Behavioral therapy tries to break you free of destructive behavior patterns that are causing you pain and ultimately leading to depression.
Interpersonal psychotherapy focuses more on the problems that the individual is having in social or occupational roles and tries to correct those problems.
Depending on the goals you have for therapy, it can be brief, meaning 10 to 15 sessions, or long-term. Experts say that a good relationship with your therapist is key to the process. You may need to try more than one therapist to find a comfortable match.
If it wasn't for group, I really wonder where I would be today.
Group therapy is another option for people with depression. With the guidance of a therapist, a group of people struggling with similar problems can try out new behaviors, learn from each other, and realize that they're not alone in their battle with depression.
People can essentially be in group therapy as long as they need to be, at a cost that is modest enough for them to be able to stay till they finish what they came to do.
Many experts recommend using medication and psychotherapy in combination to treat depression.
Medication can certainly put a floor under your depression and provide you with the stability to go on and do the work of psychotherapy. It gives you access sometimes to your feelings. It gives you the energy to do the work.
There is a light at the end of that tunnel because I know the light's there, and I didn't believe that 2 years ago. There was no light.
Whether your depression is treated with psychotherapy, with medication, or both, you and your doctors need to work together to decide what's right for you. It's important that you feel informed about the type of treatment you're getting, the goals of the treatment, and how you'll know if it's working.
Report 4. Issues and answers.
By asking questions and discussing things, you give your doctor a better understanding of your specific concerns, and that's important. Do not hesitate to ask questions. In fact, it might help to write them down beforehand. You are not the first person in your situation to have those questions, and you won't be the last.
While we were preparing this program, some issues came up repeatedly. So while we encourage you to talk to your doctor about your specific concerns, we would like to take this opportunity to address some of those issues. Here to help us with that is Dr. John Dougherty, Director of the Mental Health Group at UCLA. Welcome, Dr. Dougherty. One issue that we have heard about is people with depression have a tendency, some of them have a tendency towards suicide. Are there any clues that friends or family members should be watching for that would let them know this person is suicidal?
Yes, there are. It's important to remember that not all depressed people will be suicidal, but enough are. About 1 in 7 will kill themselves during the course of a lifetime. That friends and family should be aware of this problem. Now, there are some things that make it more likely that a depressed person will be at risk for suicide. For example, if they're drinking, that's a big problem. If they become isolated and all alone, that's another problem. And if they begin to get very hopeless, that's a third problem. What the friends and family ought to do is to ask this depressed relative or friend, are you feeling suicidal? Asking someone if they're suicidal will not make it more likely that they'll either be suicidal or act on that thought or idea. It'll make it less likely. Secondly, it puts the friend or relative in the position where they can offer some help depending upon how urgent it might be. For example, if their relative has the idea and has a plan, they should get help immediately. If they've got a plan and they've got a way to carry it out, then they should be bringing that person to help right then and there.
People might feel that this is an issue we don't want to talk about, but just the opposite is true. You should confront someone with depression, at least keep lines of communication open.
Absolutely, absolutely. The lines of communication in depression are absolutely essential. One of the things that a depressed person feels is increasingly isolated from the world around them. To keep those lines of communication open is the best way to prevent a suicide.
Another issue we hear about with depression is in regards to lifestyle and changes. For example, what's the role of exercise in managing depression? To find out, we asked psychiatrist Dr. Nanette Orman.
If I were telling a patient how to take the best possible care of himself or herself, I would tell him to get out in the morning when the sun is bright and exercise as vigorously as he can for a half hour. A brisk walk, running if that's appropriate, skipping, riding a bicycle. Even if you have an indoor apparatus, say like a Stairmaster, turn up the lights, put your machine near a window and see if you can get as much light as possible while you're doing that.
She's talking about exercise, but she keeps mentioning doing it where it's bright. How important is light?
Yeah, well, light is very important for some people who have depressions. In this part of the world, in this hemisphere, we talk about winter depression, and many people will have a change in mood during the winter time, but some people have a very severe change in mood, and we call that a winter depression. Those people will have other problems as well. They'll be depressed, they'll feel very fatigued, they'll be sleeping much more than usual, and will usually have a craving for carbohydrates. That condition, that winter depression, can be treated very easily by exposure to light.
Another concern with depression is the relationship between substance abuse and depression. What effect do drugs or alcohol have on depression? To find out, we asked Robin Gliboff, Director of Outpatient Treatment at George Washington University.
Substance abuse can have a significant impact on depression. Oftentimes it's used to alleviate the problem, but the reality is the use of drugs and alcohol can mimic depression, add to, or even worsen a clinical depression that's present. The symptoms are often the same: the feelings of hopelessness, helplessness, feelings of low self-worth, feeling that your world is out of control. Having problems with concentration, irritability, all these things are the same symptoms of clinical depression, so will worsen it.
Is there any other issue with drugs or alcohol a person should worry about if they have depression?
Well, the main point is that alcohol and depression don't mix. Alcohol can cause depression, alcohol will worsen the depression, and if you're taking medications, alcohol could, in some cases, dangerously interact with the medications.
There is an encouraging line with all of these issues of depression, and there is hope, and there is some treatment, and there is a way to control it.
Yes, absolutely. We have very effective treatments today. We have very good medications. We're developing new ones as we speak, and we have very good psychotherapies, so that the opportunity for someone to get an effective treatment and a treatment that would be compatible with who they are is available today.
Dr. Doherty, thank you very much for joining us on the program, and thank you for watching. Remember, you can use the booklet that came with this video to review key points in the program and to take notes. You'll also find a resource guide and glossary of terms that may be helpful for you. That concludes our series of reports on depression. We wish you well.
I hope we have done our job and that you have a better understanding of your condition. The knowledge you have gained should help to prepare you for decisions you may have to make. It can also help you sort out any additional information you receive, whether it is from well-meaning friends or the evening news. Facing a medical condition involves taking personal responsibility. Responsibility for keeping in touch with your doctor and other health professionals and for following their instructions. And of course, responsibility for getting the support that you need. For all of us with Time Life Medical, thank you for turning to us at this time.
To help you access important information that was covered in this program, you may refer to your personal workbook. You may also find additional information related to your situation in other Time Life Medical videos.